Okay, I'll call the special city council meeting of May 6, 2020 to order at 6 p.m. Roll call, please.
Mayor Copeland.
Here.
Tom Baylor.
Here.
Kathy Sherman.
Here.
Jeff Guard. Melina Meyer.
Here.
Ann Schaefer.
Here.
David Allison.
Here.
David Gleason.
I'm here.
That's
Okay,
quorum.
and I'm going to move quick and respect every minute of council's time. Any modifications to the agenda?
Yes.
Councilman Baylor.
Been ready. Yes, I would move that item 6 under new business be reversed, make item 6 item 7 and make item 7 item 6. In other words, the item 6 would be the last thing that we discussed tonight.
Is there any objection from council to reverse those orders 6 and 7? Are there any other changes, modifications to the agenda? Okay, is there any objection to the agenda as modified? Hearing none, 6 and 7 have been swapped, and that's our new agenda. Are there any disclosures of conflicts of interest or ex parte communications? Yes, particularly in the Sheridan Joyce case, where it might be pertinent.
Mr. Mayor.
Councilman Gleason.
Yeah, so I just told him to contact council when it's on the agenda. That was he asked, and I told him that. So I told him it through my son. I didn't actually tell him to his face.
Okay.
Yeah, my kid asked me, and I told him. So.
Perfect response. So there was no ex parte communication. You just directed him to staff. Perfectly appropriate. Councilman Baylor.
Yeah, and right after the last time he was in here, I encouraged him to move forward and try to get the building built. And if there's anything I could do to assist him contractor-wise, that I would happy to do that. Not work for him, but any advice. So I did encourage him to try to make this happen.
Okay, thank you, Councilman Baylor. Anything else to disclose? Conflicts of interest or ex parte communication, council? Okay, thank you. Hearing none, we have communications by and petitions from visitors. Do we have Dr. Zink on the line?
I'm here, sir.
We're gonna respect your time and let you go first as a guest speaker.
Thank you so much. It's an honor to be here tonight, and I appreciate the opportunity to speak. I know that there is a lot going on. There's been a lot going down in Cordova for some time, and I just can't thank you all enough for the tremendous work that Cordova has been doing for preparing for this day with a positive case. The preparation and work that you have done has been tremendous, and I was so grateful that this case was identified now and identified early prior to it getting or someone else getting very sick and ill with it. We are here to support you all in absolutely every way that we possibly can. The work that you have been doing, the medical community, the fishing industry, the people of Cordova, the mayor has been remarkable, and really appreciate your cooperation and patience in this time. And thinking of you all, it's hard to have a positive case. And there's a lot of questions, and I am here to answer anything that I possibly can. And again, just want to thank you guys for your time and opportunity to be here.
Thank you. Any questions, council? Councilman Baylor.
Yeah, thank you very much for being here. This is Tom Baylor. A lot of discussion and questions I've gotten from members of the public would be on contact tracing now that, and not particularly this incident, but somebody comes off a plane and they come in and they're positive. Who is handling that? Is it handled? And do we have a good way to do that? I guess some reassurance for the public would be helpful.
Yeah, no, thank you, Councilman. It's a fantastic question. So we have been able to do 100% contact investigation for every positive. Doesn't matter if they're an Alaskan, if they're in Alaska, absolutely any one of these cases that we take seriously and investigate. The way that works is usually a combination with our public health nurses as well as our epidemiology team, and occasionally then we also reach out to local entities, particularly like in Fairbanks, when they were getting a lot of cases. We were working with the hospital, and they were helping with that as well. And so if at any point we need assistance with that, we will definitely be reaching out and asking. We are also staying ahead of that curve, hiring additional contact investigators, just with both fishing season coming on as well as kind of the opening up of stages. What happens is the public health nurse talks to the patient themselves, the history of their story, where they've been, and they try to figure out every person that they have been in contact with, and that means anyone that they have been within 6 feet for 10 minutes or more. So it can be quite an extensive group of people, and that's why minimizing of movement is really, really important. And oftentimes that involves working with an employer, a community, and asking additional questions. If they can identify all the people that are considered close contacts, they will then contact each of those people. So anyone this person was in contact with, the public health nurse will then be contacting, and then they will be asking them to self-quarantine for 14 days. And so that means kind of staying away from other family members. That means not going to work. It means really kind of staying away, which can be quite wearisome. I really appreciate that patience. That's how we know that it's not spreading to other people within the community. And the same happens within industry. And then based on that, continue to monitor your symptoms and go forth. There will be times where we'll recommend testing in combination with the contact tracing and investigation. And occasionally we do have to announce either a company or a community or a business to say, we're concerned about this one. If you were a patron who, went into this grocery store between this day and this day, or we're here between this time and this time, we need you to contact us. We try to use that as a tool of last resort. And so if the community does not hear any calls or needs for that, we would do it via media and radio and contacting you all to just let you know that this is a need. It's a little bit easier in smaller communities. It seems to happen a little bit quicker than places like Anchorage. Then we will do that. But if otherwise you don't hear from someone specifically, then you are not thought to be a direct contact, and they spend quite a bit of time doing that and following those cases throughout their entire course. Does that answer other questions about that?
Okay, yes, that answered that question. Other questions, Council? I'm just,
Councilman Gard.
yeah, and then I'm going to just go through the checkoff list that I have in front of me here. Go ahead, Councilman Gard.
Yeah, just one quick follow-up to that. One of the questions that keeps coming up about that has to do with air travel. And say you have 3 people sitting in a row or 2 people sitting in a row. One of them gets off here, the one that flies on through ends up the next day with sore throat, fever, test positive. Is there a mechanism to trace that travel back through the airline carrier so we'd find out about it, or how does that work?
Yeah, great question. Absolutely. So on the CDC website, they actually have a chart on the plane of kind of where someone sits and who is considered close contact based on sitting charts on a plane. And that's exactly what we do. We reach out to the airline, get a manifest of who sat near that person, and then reach out to those people with close contact. We do see decreased spread with masks. And so there are times where someone might be kind of in that medium or gray zone, and they aren't really kind of sitting right next to them, and they were wearing a mask, and the person who was symptomatic was wearing a mask, that we may say, okay, let's just keep a close eye on you, but we don't have to do as strict a quarantine. For that perspective, there are little gray zones, but you're exactly right. We work with the airline company themselves to try to identify anyone they're sitting around.
Thank you very much.
Thank you.
Okay, Councilman Schaefer.
Hi, yes, thank you. Dr. Zink, I was just wondering if you could speak to what your perspective was on the risk to the community at this point.
Yeah, no, great question. The fact that this is a travel-associated case, the fact that we know how this person got in and where they likely conduct, that is very reassuring when I think about a whole community. The communities that I worry the most about are when we have an unidentified case, when they're a community member and we don't know how they were exposed. We worry that it's kind of silently moving through the community quickly and stealthily. And so from a community-wide perspective, I would still consider the risk of Cordova low at this time. We know that as a world pandemic, it's still there, and anytime we get an entrance into any new community, it is always concerning. We put a lot of time and energy early on. You can see communities like Ketchikan that had early, cases that really did social distancing, good hand hygiene, and we are really not seeing many cases at all. Fairbanks is, I think, lots of cases and then very few. And so if we can quickly identify, isolate, and contain these cases, usually we can contain a case and keep it to a very few. So the hard work that you are all doing now is going to pay off, and we see the risk in Cordova right now fairly low.
Yeah, thank you. Councilman Meyer.
Yes, thank you, Dr. Zink, for taking the time to join us today. I had a question about testing, since from what I've heard, this test this person was tested a little while ago and it came back negative and then tested again positive. So that kind of just reaffirms that the multiple testing was really crucial in identifying this case to help stop the spread. So seems like locally our testing capabilities have ramped up locally, but do you see Corova getting even more tests available for us to do this multiple testing?
Yeah, no, it's a great question, and testing is really critical. We don't know if an individual picks it up between that negative test and that positive. We also know that the tests are perfect, and there's always the risk of a potential false negative, and that's why watching symptoms, minimizing group transmission, as well as repeat testing can be important tools. Regarding testing, absolutely. So we have been working hard with the federal government. We actually received what we call Cepheid machines, which are a medium throughput, but much more throughput than the Abbott machines that are down there currently. They came in on Tuesday and had one designated for you all, and we are working on the details to get that shipped down there as soon as possible to be able to do increased throughput testing specifically in Cordova on that machine so that we don't have to use the Abbott machines nearly the same sort of way. We also have significant increasing ability at Alaska State Lab in our supporting any swabs that come up that way. It's important to use kind of the right tests for the right reasons. If you need an immediate turnaround, the Abbott's really good. This stuff is going to get you answers in 3 to 4 hours. If someone can safely wait a day or two, then having it be at the Anchorage lab is useful just for reagents and restocking purposes. And then also, just like this case, industry has been partnering to try to do testing. So I really appreciate industry stepping forward and helping with testing. Just like in this case, they had initiated that testing to be able to make sure that this case was identified early. And it's really important to just recognize that commitment is there, and we really appreciate it when companies do that, because that makes the whole process much easier.
Okay, thank you. Councilman Allison.
I don't have any questions. I'd just like to express appreciation to you, Dr. Zink, for all the work you do for us and for Alaska. Thank you.
Thank you. You guys are really the ones on the front line, and so the real deserved thanks goes to you all. Yeah, happy to support in any ways we can.
Councilman Sherman.
Yes, thank you, Dr. Zink, for participating with us tonight and for your help earlier in the day as well. I just had a question about the expanded list of symptoms. I know it continues to grow, and I was just wondering if you anticipated more symptoms kind of being identified and added as we move forward with some of the things we're learning.
Great question, and you're 100% right. There are more symptoms added, I feel like, all the time. We did add symptoms to our diagnostic that now the CDC has added to theirs, and there are more symptoms that we talk about that are not on the CDC or our guidelines, so I do anticipate more. So, for example, young kids with funky rashes are really not there's a disease called Kawasaki's disease. It's a fairly rare disease, but we're starting to see that in children, and there's a concern that could be associated with this. We're having a low threshold of testing any kids or younger people with a new onset of a rash. We know that people can be asymptomatic, and so if someone's had a close contact or exposure or has been around someone sick, again, we're encouraging testing. As we've seen with this case, travel is a definite risk factor, and so for that reason. And then particularly non-onset vomiting, new onset weakness and fatigue, that loss of sense and taste is also a really, what's called pathognomonic or really kind of specific for this disease. Most people do develop a fever at some point, particularly those who have a normal immune system. Those who are immunosuppressed are less likely to develop fever, including people who are older, really over 75 or so, tend to not develop a fever as much. So I would expect new symptoms. We learn new things about this disease, I feel like, every single day. And that's part of the reason for really trying to slow the spread, is because it helps us to learn about it and learn about the risk benefit, what to look for, and how to manage it as quickly as we possibly can.
Thank you. Thank you very much.
Councilman Gleason.
Yeah, I don't really have a question for Dr. Zink, but, I would just say we've recently implemented a face mask rule, and maybe you could just touch on the benefit to the community of people wearing face masks.
Yeah, thanks for that question. That one, it gets a lot of controversy at times. But really what we're trying to do is to minimize what we call the droplet and microdroplet spread. So this virus itself is very small. It tends to live in the spit and saliva in your nose and throat. When people talk, they can project their voice and they can create these little droplets and micro droplets that come out of their mouth. Some people sit and, when they talk a little bit more or have more micro droplets, some people do that less. And those little droplets can then fall to the ground and land on surfaces. They can linger in the air, particularly those micro droplets, for an extended period of time, and they can travel longer distances, particularly those micro droplets than the heavy droplets, and they contain my virus in them. So if you're talking to someone, particularly if you're within 6 feet, then that micro droplet or droplet can then you can inhale and get your nose, your mouth, and you can get the disease. So the mask itself doesn't do as much to protect you, particularly these cloth face coverings, because it can come around the sides and other ways, but it does a lot to help protect others. And it's really this, I wear mine for you, you wear yours for me, and together we really reduce the spread and transmission. The other thing is it catches it on that mask, so it's not hitting on what we call fomites, or hard surfaces that those virus can live, such as a doorknob, a handle, a keyboard at a, ATM, things like that. So you want to make sure that you're not having the droplets spread to other things, and that mask can make a big difference in minimizing that viral load and that spread as well. And so that's why we're encouraging everyone when they're outside their house to be wearing it, and when they're in public. They're uncomfortable. They're definitely not part of our culture. Some people, particularly kids less than 2, should not be wearing it because they can suffocate with it. But the more that we can do this, the more we can just live our normal lives, and the more we can minimize the transmission. So I really appreciate you passing that. It's a big change. It's hard for me to wear one. I'm not used to wearing one. But I do think it's not an end-all be-all, but it is an important tool to minimize that microdroplet spread to protect your community.
Thank you, Dr. Zink.
So, Council, are there further questions for Dr. Zink?
Mr. Mayor, this is Councilman Schaefer.
Councilman Schaefer.
Hi, yes, I just have one more question. Dr. Zink, at this meeting, we're actually going to be discussing whether or not we should loosen up our local restrictions to be more in line with the state restrictions. So we've maintained for restrictions in terms of which businesses can be open and whatnot. So I was just wondering if you had any insight to offer in that regard on loosening restrictions in light of having our first case come to town and having an influx of fishermen and people coming to work at the processors within the next couple of weeks.
Yeah, that's a great question. And, you guys as councilmen are a hard position. It's hard to have your first case on the day that you're debating about opening up. It's kind of the opposite of many other communities who are seeing a decrease in cases. We are looking at numerous communities and despite ongoing community transmission, such as Anchorage and Eagle River, still saying that these are isolated cases. We don't believe that there's widespread community transmission, and therefore we think it's okay to open up. A lot of this comes down to personal responsibility and how much people are able to wash their own hands, wear a mask, stay 6 feet apart, minimizing larger groups together, making sure those tables are spread apart, and making sure that big groups aren't getting together. At this time, we don't think that there's community transmission within Cordova. We think this is an isolated, travel-related case. If this was a community-related case, it would be very different. That's really, up for you all to decide. There's no reason for us to think that there is community transmission at this time. Always higher risk when it's in the community, but with those personal mitigation skills and what you're doing, that would be very similar to what other communities like Anchorage and Juneau and Fairbanks are doing as they move forward, despite some transmission, and they've had community while you have traveled at this time. Does that help or just confusing?
No, that was very helpful. Thank you.
All right. Yeah.
Okay, any other questions, Council? Well, thank you very much, Dr. Zink. We really appreciate your time and calling in, and as Councilman Sherman said, not just this evening, but pretty much all through the day. So really appreciate the support and outreach from the state, and look forward to managing this for our plan. So thank you.
No, thank you guys. Thanks for the partnership, and we're in it together. So you guys take care. Feel free to reach out if there's anything else we can do, and we'll be in touch soon.
Okay, so Council, we're under communications and petitions from visitors, and the incident management team report is also a guest speaker.
I think it might be Dr. Sanders if she's on the line.
Dr. Sanders?
I am on the line. I was just going to speak to the the Cordova moving to the phase 1 and starting to talk about opening up, one of the things that we've been talking about for the last week or two is just what a critical time this is for Cordova as we are bringing in this influx of industry workers and getting ready to open up fishing. And I appreciate everybody being patient. I know everybody's super anxious to start opening their businesses and getting haircuts. So thanks for your patience. We have been talking about how we safely do this, and I think the state has an excellent plan. They have lined out the regulations for each different group of businesses, and I think if we follow their plans, we're going to be able to have a really great, successful summer. My guidance is going to be that we continue moving forward to prepare to move into phase 1, or what Cordova might refer to as the yellow light phase. As we do this, I don't think that we're going to be looking at saying, yes, let's open tomorrow. This is our first case. We're still tracking and contacting and trying to make sure that this is as contained as we think that it is. So, but soon we're going to be ready. So I think it's time for the council to think about giving the authority to the incident management team, along with our medical advice for the city manager, to be able to move us forward when we're ready to open. Any questions for me?
Selena.
I'm sorry, which councilman is that?
Selena.
Councilman Meyer.
Question regarding this reopening phase, and then maybe on the next round I have a couple questions about the positive case that we had today too. But so with your advice, I was just watching the state press briefing, and the state looks like they're looking into moving them to the next level of reopening, and Cordova here first, we're looking into opening up to the level where the state's at currently right now. How does this new positive case, you kind of talked about how that affected it, but for us as council, when, I guess we don't have a specific date from what you were kind of talking about, so just giving the authority to open it up. I guess that's not really a question. I just was like going through.
Well, I can speak to that a little bit. I think that right now we're looking at moving to phase 1 with a lot of really excellent safeguards put in for each business type and a very slow reopening. We're a much smaller community than Anchorage or any of these other places that are looking at going to phase 2. I think that in addition, our population is going to grow over the summer pretty significantly with fishing. So in terms of Cordova looking at phase 2, I think that's pretty far down the road for us. It might even be, depending on how the next couple months go, all the way to toward the end of the summer before we really start looking at phase 2, and when is our population going to be small again. A lot of the numbers in other communities is based on their number of ICU beds and their larger capacities. For us, we have a very small healthcare system, and it doesn't take a whole lot to overwhelm our healthcare system, right? So we're going to be pretty cautious this summer with having everybody out moving freely and gathering into large groups. But right now, we want people to continue, even as we reopen, continue face masks and social distancing and being very cautious with their personal hand hygiene and wiping down those high-touch surfaces.
Councilman. Okay, Councilman Baylor. Oh, sorry.
Yeah, thanks for being here. And then I guess just you mentioned our healthcare system, but and correct me if I'm wrong, Anchorage is not overrun with their healthcare system there. I think they've only had 8 or 9 or 14 patients hospitalized. So in a worst case scenario, there would be an option to utilize their healthcare system in Anchorage. Would that be a fair statement?
Absolutely, and we always intend to utilize, and Cordova utilizes the Anchorage healthcare system a lot when we have critical patients. So we absolutely will be using those systems with the intention of not having, a medevac system. Our intention is to not have to be medevacing multiple patients in a brief period of time. So our goal is to keep our system able to manage on how Cordova normally manages, which would be trying to not be in a position where we're having more than 1 or 2 people needing to leave Cordova at a time.
Thank you.
Councilman Guard.
Sorry about that. Took me a minute to find the mute button. I haven't got any more questions. I just want to thank Dr. Sanders for all the hard work she's done with us to help keep us all safe. Thank you very much.
Councilman Allison.
Yeah, thanks, Doc, for being here tonight. I just have a question, I guess, maybe along with a comment, but I mean, we're talking about the influx of people coming into town, into the fishing industry, into the processors, but those are essential businesses, and we don't have much control over them other than face masks and following those additional policies that the state has in effect. I'm wondering where the risk is in opening up the other, what are considered non-essential, on the technical term, I guess, businesses such as the fabric store and the hairdresser and the fish shop and clothing store. And how is the risk anymore by opening up than it is to, or following the state guidelines than it is to have more restrictive guidelines?
I don't think that we have any intention to have more restrictive guidelines than what the state has in terms of moving to phase 1. I have not seen phase 2 yet, so I don't know how that will apply to our community. We'll see. And in terms of just the timing of this meeting, I think yesterday we were all ready to say, yes, let's open up the day after. Let's make sure that we're ready to open Thursday morning. Now, this is our first case. We're still double checking that there wasn't community exposure. It seems almost silly to just automatically be opening up the next day right after your first case. I think right now, let's give us 24 hours. Let's get the public health system, get all the contacts traced, and make sure that we get everybody tested that was in contact, and then we'll look at opening up. I anticipate that's going to be relatively soon here. If we don't identify any other cases, maybe Friday, maybe Saturday even. Right now, I think the goal is to, and I think people will speak to this later, the goal is to get us ready so that we can be a little bit more nimble in that opening, because I agree, 4 or 5 days ago, there really wasn't a risk. We probably could have been safely allowing people to get haircuts and be in the fabric shop. Today, risk is a little bit different. We want to be able to respond quickly to these situations as they come up.
I guess just to follow that up with a comment, I don't see where the additional risk is. You're still going to have those processors risk. We can't control that. You're still going to have the fishermen. Yeah, we're not controlling that. All we're doing is saying that your risk happened when the state said you have to leave your grocery store open. The post office is open. That's where our risk is. It isn't in opening up the additional small businesses. That there just isn't the risk there, in my opinion. But I appreciate your work, and I understand that there's a little bit of fear level in a lot of people around. But as the governor's team has said many times, we're not to base our decisions on fear. It needs to be based upon statistics, and this statistic would have happened regardless, and it just isn't attached to opening up the non-essential businesses. So that's just a comment.
Councilman Schaefer.
Hi, thank you. No, I don't have any questions at this time. I just want to echo the thank you to Dr. Sanders for all your hard work and for being so helpful in calling into all these meetings. And thank you.
Councilman Gleason.
Yeah, thanks for being here tonight, Dr. Sanders. I was under the impression that the COVID case came from the airport straight to the processor and hadn't been anywhere else. Is that correct?
I think we're still waiting to hear from the state and epidemiology and what their report says. I'm not certain on the contact tracing because I have not participated in that piece. But as soon as we have any information or know what other risks there are, we definitely will as Dr. Zink said, we will be notifying any potential contacts and make sure that we're monitoring and testing them. So every time there's a new case, it just takes a little bit of time to figure those things out. And like I said earlier, over the last week, they have been very, very positive and wanting to get us moved to that phase 1. I still want to get us moved to that phase 1. I just also want to give epidemiology a chance to trace the contacts, get the tests completed, and have them resulted, and then we'll move forward.
And Councilman Sherman.
I don't have any questions at this time, but I had two. I was going to thank Dr. Sanders for participating and helping us out today through the first part of the morning. And I think your presence is very welcome in the community because you have a very calm demeanor, and it came across lovely on the radio today. So thank you for that.
So, Council, we're half hour in, and I intended on kind of having a little preamble. The code can limit discussion to 10 minutes. However, these are both medical professionals. You've made it clear you'd like to hear directly from them. You have a couple of medical decisions in front of you. So I've kind of just extended that by proxy for you. Would you like to continue with another round of questions, or would you like to move on with the business items here? So I guess, are there any further questions by council?
Yeah, this is Melina. I just had another follow-up question just about testing.
Shoot.
Yeah, so I had a couple questions about this positive test. And for one, I am glad that it was someone that was caught, it seems like, fairly early on the second round of testing at a facility where they're already practicing good guidelines from the sounds of it. I had a question on, one, where was the test taken? Was it at CCMC or NVE, just one of our local facilities? Or was it the employer conducting the tests there? And then my other question was about how many tests we have locally. I think sometimes there's a little confusion on the number of tests that we have equal the number of people that can be tested, or do we use 2 tests per person? How does that number lay out for the community?
Yeah, certainly. So going to the testing, this particular test was one that the employer had purchased for their employees, and MVE participated in helping swab and send it out for them on their behalf, and then the test was reported to their the ordering provider that worked with the company. So it wasn't necessarily ordered by us here locally, but it was the test was collected with our assistance. And then today we went out and retested the group, and the first round of testing today NVE did, and we're going back and forth between the hospital and NVE, sharing resources, sharing machines, sharing staff, and just trying to make sure that we can have the best access to testing. Because of this test today, our testing abilities, although they've been growing a lot over the last week, have grown significantly in, I would say, in the last 24 hours, and we have support from the state for getting access to as much testing as we need. Now, this is going to still be medically indicated testing, so until we have a thought that there might be community spread, the Department of Health would not be recommending that we just test everybody. We don't want to test everybody prematurely. If we have any inclination of community spread, we would then roll out community-wide testing and get everyone tested. Right now, we're testing Anybody that's had any out-of-state travel in the last 2 weeks, anyone that comes in from out of state, anybody with symptoms. In the symptom guidelines, you guys see, they should be posted everywhere so everybody kind of knows. We don't have any limitations on how much symptoms somebody has to be having or their age. We used to have comorbidities that limited our ability to test. We don't have any of that. We can test anybody that needs to be tested. And if we need more supplies, we can have access and can get more supplies.
Hey, thank you, Dr. Sanders. And for those councilmen online, we also have Incident Commander Paul Tremblay and Deputy Commander Mike Hicks here in the audience. And then the rest are just Jason, IT, Helen, Councilman Baylor, Councilman Allison, City Clerk, and myself. So under audience comments regarding agenda items, because we are over halfway through the meeting, I encourage anyone in the audience, nobody has called in so far, to recognize that we have a 7 p.m. regular city council meeting, and your comments will be welcome on that agenda. We're not trying to restrict public comment, but we do have a fairly short meeting here with some action items for council to address. So council, is there any questions or comments on the correspondence? I just ask openly rather than go down the list. Hearing none.
Yes.
Councilman
Well,
Meyer.
I just wanted to make a comment about the email from Susie. It was an email from staff, so I didn't feel comfortable emailing her directly. I wasn't sure of the protocol for that. But I know that I did make some comments about the incident management team contacting the businesses, and in no way, shape, or form was it insinuating that they're not doing a good job or they're not trying their hardest to get information out. I really appreciate the information that has been put out. Kind of my line of thinking saying that was I thought that a mass email could have been sent, even just a one-line email saying, I know the state's thinking about reopening. We're considering this locally. Stay tuned for if Cordova's going to reopen, kind of along those lines. I don't know what all the capabilities are at the city for that mass email to be sent out, but I know business owners were sent emails about city tax, so I thought it was a fairly easy kind of communication stream, and my comments were just about strengthening that stream. And we have the chambers, good resource too. Some are members, some are not, but just kind of expanding that, especially during this time when we're closing businesses, opening up businesses, things are just changing very rapidly. So I just wanted to kind of comment that publicly.
Okay, thank you, Councilman Meyer. Yeah, it's hard to know until your message gets interrupted by a change by the state that you aren't going to be sending that message out. And what happens 3 times, the incident team gets pretty frustrated themselves. So any other comments on correspondence, Council? Okay, new business. First item, Resolution 05-20-19, a resolution of the Council of the City of Cordova, Alaska, pre-approving emergency order 2020-06 regarding the repeal and reenactment of the City of Cordova emergency COVID-19 rules.
So move.
Second.
Have a motion, Councilman Allison, and second, Councilman Baylor. Councilman Allison, would you like to speak to the motion?
Yeah, I'm in favor of the motion, the resolution, and the emergency order. I've said it several times, but I just don't see the additional risk in opening up the what some would call non-essential businesses. Adds to our risk assessment in Cordova. I believe that the risk is in the processors and the fishermen, in the grocery stores and the post office, and it's not in the little mom and pop shops that are trying to stay in business and make a living in town. So I agree with the governor. If you listen to his press conference tonight, he answered a question too that really rang true. These businesses aren't opening up so that they can get somebody sick and send them to the hospital. They're going to take every precaution in addition to what the state is already requiring. So I'm in support of opening this this up and spending our time working on educating people and making sure that everybody understands why we do the social distancing and why we wear the face masks and the training and the education of people and the providing of the resources in order to do that adequately. So I support it. Thank you.
Councilman Baylor, second.
Yeah, I would echo Dave's comments, and I have no doubt that the couple of hair salons that we have in town can operate very safely on a one-on-one basis. I think they've submitted their plans and their thoughts, and I just see no risk in there at all. I think they can operate safely. As far as restaurants, I know, have we talked to the restaurants? I'm not even sure if they'd want to open still with the restrictions that are on that. It would even be feasible for them. So I don't know what conversations were had with the other businesses that would be open. And that's another, what businesses are we talking about? Because the hardware stores are open. The gas station's open, fuel's open. I think, what are we talking about? We're talking about a couple of hair salons, and we're talking about the knitting shop. I should know the name of it, but I don't sew the. Somebody help me out there. Netloft, thank you. What else are we talking about? And has staff or the IT, have they talked to them about their procedures? Because I'm sure these, I've said this before, they're all owner operators, and they are gonna take the utmost of care. They're putting themselves out there at risk. So I feel that they can operate safely. And I would agree with the governor's, Dr. Zink, that we should move forward with that.
Councilman Meyer? Discussion?
Yeah, I don't have too many questions right now. I guess my line of thinking, maybe after we go through the first round, see what everybody else thinks, but we have gotten advice from Dr. Sanders maybe to change the opening date to after they do some of this contact tracing. So maybe instead of May 7th, we might want to think about changing it to maybe Monday morning, have it effective Monday morning on the 11th or something. But yeah, I agree. I think the businesses that are wanting to open are a lot of one-on-one businesses. At some point, I would like to hear, we heard from Dr. Sanders, but if there was anybody else from the incident management team that wanted to speak a little bit about to what Councilmember Baylor said about what kind of contacts they made with businesses, or if the communications that they had with them were ones that filled out mutual aid agreements, and what kind of businesses we actually are talking about here.
I think your city manager has something to interject in that regard.
I think one thing that we need to be careful of is, and this happened last week, I think, when businesses were hopeful, or the week before, when this first state mandate 16 came out and people were hopeful that we were going to open. And some businesses went ahead and prepared themselves as though we were going to reopen, and we didn't. One of the cautions I want to throw out is that the medical team at any point in time may decide that we are not in a position where we can open. And we don't want to put businesses in the position where they're having to yo-yo back and forth between, oh, I can open, oh, no, I can't open. So I would encourage you all to consider that as a possible influencer on if for some reason, as Dr. Sanders was suggesting, that there might be something that we are unaware of because they haven't had the ability to do the contact tracing yet and understand how that individual is impacting our community. There is the potential, slight though it may be, that we find out that that individual had more interactions with our community than we thought, and that may put us in a situation where where we would need to go back to a red status. So just keep that in mind. I think the business community that I've heard talking to have communicated with me, the chiropractors and the massage therapists and those kinds of folks, the pet stores and the various small businesses that are in town that will be impacted by this and would love to reopen and reopen responsibly. So I agree with everything that's been said. The communication coming from the business community is that they are going to do everything they can to keep not only our community safe, but their business viable. So I don't think there'll be a problem once we come to conclusion as to what direction we want to take at this moment.
Councilman Schaefer.
Hi, yes, thank you. I think it was really helpful to have both Dr. Sanders and Dr. Zink earlier on to answer questions and field our concerns about the positive case in town. I did have a question about someone contacted us wondering if churches fell into this new yellow phase, and I was wondering if you could clarify that.
There's a limitation on the number of people that can congregate. So assuming that a church would have more than 20 people total and could not or could maintain, had less than 20 people and could maintain social distance and all of those health requirements, I think they could meet. But if there are more than 20 individuals it's not possible at this moment in time by state mandate for them to meet.
Okay, thank you. And then another question of clarification. For these non-essential businesses to open, they have to complete the MAAs. Do those have to be completed and approved before they are able to open, or do they have a time frame by which they need to submit them?
If they're signed, it's a legal document that enters the business into a contract with the city saying that they will follow our COVID-19 rules and health requirements. So it doesn't need to be approved. They are, by signing it, they are entering into an agreement. So as soon as they do that signature, I sign them on my end just as a matter of course, but their signature is what it takes to enact that mutual aid agreement. I didn't answer the question. As soon as they sign it and turn it in, they're open, yes.
Okay, so it's turned into the city. It doesn't have to be assessed for, if it follows all the guidelines?
No, because their mutual aid agreement is a written document, legal document that we have created, and they're signing our document.
Okay, thank you.
Councilman Schaefer, you had questions. Did you want to speak to the motion? Yay or nay? I'm not putting you on the spot. It just helps signal council.
Okay,
The rest of council.
At this point, after hearing from both Dr. Zink and Dr. Sanders and our own incident management team, I am in support of this, letting some of our smaller businesses open up, as long as they've got good plans in place that they're comfortable with to keep themselves and the community safe.
Councilman Gard?
Yes, thank you. I think we'd all like to see everything get opened up as rapid as we can, as long as it's safe. My question is, do we need to put date specific in this resolution, since we have the authority with the incident command team and the medical team to tell us when it's safe to do this? Do we need to put a date in there, or can we just put as soon as possible?
Well, Councilman Gard, I think, so your council has declared an emergency declaration that empowers your city manager to open it if and when. That would be one option. Another would be if you didn't want to open it this meeting to, I don't know what would be the trigger after that, a special meeting or the next special meeting. So those would be the options, I think. Susan?
I was thinking more of the if and when. It sounds like the medical team is ready to open this as soon as they can and can chase down some last minute information on this to make sure they feel comfortable about it without putting a date of opening on the 7th.
City Clerk?
Well, yeah, the effective date of the emergency order, you are kind of pre-approving Helen putting the emergency order in to start tomorrow morning at 9. That's what the resolution is doing this time. You guys are pre-approving her to put in the emergency order May 7th at 9 a.m.
But she can still keep it in the red phase it could still be kept in the red phase till Thursday or till Friday or Saturday or whatever. They can get the information back and then opened up the way it's written, currently written.
Council, this is Holly Wells. If this is an appropriate time, I can weigh in on this question.
Please.
So the way the resolution really was designed to give council the ability to engage more specifically in the emergency order and the COVID-19 rules this round. So that means that from everything that you've heard, if what you want to do is amend the resolution to add a provision that says you approve the emergency order with either the stated effective date or the first or the date identified by the medical team that is appropriate for reopening, that's fine. You can do that, and then that allows the city manager to retain the authority to work with the medical team, and really the medical team, the authority, to change that date as needed, with the understanding that council's approval is only to the earliest date possible based on their medical assessment. Does that make sense?
I'd so move.
Yeah, okay, there you go.
Is that a motion to amend, Councilman Gard?
What's that?
Is that a motion to amend to include May 7th, 2020, or the dates specified by the medical team?
Yes.
Second.
And who was that second?
Sherman.
Councilman Sherman. Okay, Councilman Gard, you still have the floor to speak to your amendment.
I just want to get everything opened up as fast as we can for everybody, but I want to do it in a safe manner. I don't think our medical team is asking for any long period of time. I think they're in favor of getting things opened up as fast as we can, so.
Okay, Councilman Sherman?
Final rule.
Okay, thank you. Councilman Sherman?
Yes, I agree. I think based on the events of the day, the advice that we got both from Dr. Zinke and from Dr. Sanders, this would be the smartest way and safest way for us to make this happen. We all agree that we need to move into this next phase, but I think waiting until we have the results from the state on the contact tracing and whether it's travel related or community spread, that's a biggie. So we need to figure that out, and I am in favor of the overall resolution, but this would make it perfect for me.
Okay, Councilman Gleason to the amendment.
I'm not in favor of the amendment. I'll just leave it there.
Okay, Councilman Allison.
Yeah, I appreciate this coming to the council prior to it going out to the public. I don't think that anything we've had so far has been an emergency, and I think all mandates should come through the council if it's not an emergency. Some people would classify this as an emergency, and we did so that we could get federal and state funding, but really we haven't had an emergency yet. I believe, speaking directly in opposition to the amendment, that we need to have a date. And I still, over the course of 2 meetings and a week now, haven't heard anybody tell me where the risk is. And in my mind, in a lot of people's minds, we're trying to punish the little guys for not being able to control the fishing industry and the processors and the grocery stores and where the real risk is. So I just don't see the risk in letting these other people open up responsibly, and therefore I think that the date is good that's in there as soon as possible. So I think both doctors were not against that. Dr. Sanders would certainly like to see more time. She'd like to see the whole summer in that mode, but I don't think that's based on risk. I asked the question directly about risk and did not get a get a risk answer. So I'm against the amendment.
Councilman Meyer to the amendment.
I say one thing really quick. Sorry, this is Dr. Sanders. I'm still on.
Dr. Sanders.
I don't want us to be closed all summer. I hope that was not the understanding you all got away from me saying that. I absolutely want to move to phase 1 opening as soon as possible.
Okay.
Sorry, just to clarify that.
You bet. Thank you. Councilman Meyer to the amendment.
Yeah, I think that amendment would be, I'd be in favor of that amendment. I really don't want to put this off. I think that the resolution that we had in front of us and got it, happy to see it, had good recommendation, had a lot of information behind it, and really appreciate the work that went into bringing this in front of council. I was excited to open up some of these smaller businesses with this guideline and with the recommendations that we had. This new case, it doesn't change a lot of things. We're still practicing social distancing. We're still doing all the things that we need to be doing. But we did get our first confirmed case here in Cordova, and I think it would be wise for us to at least wait for that contact tracing to be completed. I don't want to have this drag on for a long time. It sounds like the medical team is ready to open up for this phase 1 as soon as they get that report and feel comfortable to doing so. So I'm going to vote in favor of this amendment.
Councilman Baylor to the amendment.
No, I don't agree. And to be honest with you, I'm trying to compose myself because I'm a little bit upset, especially by comments made by the city manager. I guess I would remind everybody that in December, we hired this manager earlier in that, and mayor, we were all having discussions on how we could get some economical diversity in this community and how we can support our local businesses. And now it appears that we're doing everything we can to not let those businesses open. And to say, I don't know if a business would want to work a week and then shut down. Oh, gee, make enough money to pay the rent and buy groceries? Of course they want to work. And we're in this for the long haul. What are we going to do every time? If we get businesses open, we get one case, are we going to run down and shut everybody down again? I mean, we should have and we could have opened last week. And had we opened last week, the question I would ask the doctor, had we opened last week, would you be now calling for us to go back and shut everybody down because we had a cannery worker come down with a virus? I'd like her to respond to that because we're going to be doing this all summer. We will have other cases. We need to get on our lives. We need to operate as safely as possible. And I've said it many times, these owner operators have the ability to work very carefully. They know who their customers are. This is not like the grocery store, like anybody walks in. So I'd like, if the doctor could, to respond to that. We are going to get other cases. So every time we get a case, are we going to recommend shutting this down?
Thank you for asking me that, and Councilman, I really appreciate the question because I too have been in support, and I have liked the state plan ever since it was rolled out. I think that they've got an excellent plan, and I want to be able to follow it. If we were open already, would I be saying let's close tomorrow? Absolutely not. All that I'm saying is right now, here we've come this far, we've been patient so far. Should we open at 8 a.m. the day after we have our first case? Or should we give it 24 hours to make sure that there's not further, that we have been really cautious with that risk so that we open once we know, yes, this was indeed isolated. It's simply the timing. If we would have opened 3 days ago, would we be now closing because we got one? Absolutely not. We would be doing our contact tracing and doing this. Right now, we're just right in this zone in the middle of our first case. So I'm just asking for 24 hours to make sure that there's not a risk to the community.
Okay, well, thank you for the answer. And I could support 24 hours. That's a definite time, not this vague, whenever they feel safe. So if we can amend the motion to say 24 hours, I would support that. And I think the community members, the business owners that are itching to get back to work, I think would totally understand that. So if 24 hours today is Wednesday, are we talking Friday morning then? Would that be appropriate? 24 hours away, Friday morning opening up? I guess I'm asking you, Doctor.
That's what I had initially said earlier when we were in my comments. I said maybe not tomorrow morning, maybe Friday morning. So that gives us time. Of course, if new information comes out, we might be recommending a change. I don't anticipate that. I don't anticipate that at all. But I think just right now, given our current status today, it would be wise for us to give a small amount of time for that contact tracing.
Okay, and I really appreciate your answer to that, and excuse me if I'm coming off a little bit rough. I apologize to you, and I know you're facing a difficult job, but I could totally support if we amend the motion to give the okay to open Friday at 8 a.m.
Second the amendment to the amendment.
Okay, so I might ask for your help, Holly, because we have amendments slightly conflicting, or if a councilman wants to withdraw their amendment or revise their amendment. What's our options, Holly?
Yeah, a lot of times what I see is just sort of an amendment to the amendment, a friendly amendment to the amendment where the sponsor of the motion to amends our language. So, I mean, and Susan, you correct me if I'm wrong, because this really is, a detailed parliamentary procedure here.
Sure, if Guard wants to, it was his first amendment. If he
Okay, I'll get there. Councilman Guard, based on the discussion with the doctor and feedback from council, are you willing to revise your amendment?
I've got no trouble making time certain on this, as long as Dr. Sanders thinks that 24-hour time period will get her back from the state the information she needs to feel comfortable. I'm all in favor of getting everybody opened up so they can make a living. I understand financial security is a health and well-being issue.
Okay.
I don't want to see anybody shut down, but I want to make sure we're doing this for the right reasons, not political. We're doing them for science-based reasons.
Thank you. Councilman Sherman?
I would agree with that.
Okay, so the amendment's revised to, and I'm sorry, I had two different times. Is it 8
I didn't revise yet. I asked to hear from Dr. Sanders.
Okay, Dr. Sanders.
Be able to get the information she needed back.
Okay, I think the question is, would you have the information back?
It gives us a lot more time to get that figured out and make sure. There's a fair amount of uncertainty in the setting of this virus. I hear a lot of what's the risk and how do we calculate the risk. Each person that you encounter, you're trusting that they have encountered all the other grocery stores and gone about their lives in a very safe way. Because when you encounter them in a close setting, such as a chiropractor or you're cutting their hair, you are being exposed to every single person that person has been exposed to. So by opening a few of these, we start connecting the web of contact throughout our entire community instead of keeping isolated in homes and where people are. There is some risk to reopening, even when it feels really small. I really want us to reopen. I want the hair salons to be able to cut hair. I want small businesses to be able to make a living. It is so important. I want people to be able to get back to their normal lives as best they can so that we can spend the summer getting ready for the hunkering down in the winter like we do every winter, not just the coronavirus, right? So I think it's very important that we get people active, but we do have to recognize that we are trusting people when we start coming into close contact like that. We're trusting that everybody that they have been around is also behaving responsibly.
Okay, so Dr. Sanders, the question was...
There's no certainty, but I think that giving a 24-hour period to have some more answers here would give us enough time that if there is a danger to the community, we can identify it before we have reopened all the businesses.
Actually, we're giving over the 24 hours.
Okay, so that's your, so that means there's 24 hours in addition to the time that's going to transpire between now and tomorrow morning. So to be clear, it's, 36 hours or whatever total. So Councilman Guard, that's your answer?
Yeah, if she's comfortable with that she can get the information back she needs by Friday morning, I'm more than comfortable to open Friday morning.
I'll take that as a friendly amendment to 9 a.m. Friday, May 8th. Councilman Sherman.
I can agree with that too.
Okay.
The question?
So, well, we have Ann Schaefer, Councilman Schaefer hasn't been able to speak to the amendment yet. Councilman Schaefer?
Yeah, thank you. I can support this amendment. I'd like
Okay.
to see everything open up, but I'd like to do it in a time scale that our medical professionals are comfortable in.
Okay, I've heard 5 councilmen in favor of this amendment from May 7, 9 a.m. May 7th on 2020 to 9 a.m. on May 8th, 2020. Is there any council in objection? Hearing none, roll call vote, please.
David Allison,
Yes.
Ann Schaefer,
Yeah.
David Gleason,
Yes.
Kathy Sherman,
Yes.
Melina Meyer,
Yes.
Tom Baylor,
Yes.
Jeff Guard.
Yes.
Motion carries 7-0.
Okay, thank you. So, council, it's 7:05. I think the public and you can appreciate that you're getting medical guidance and making these decisions, and that's just taking a little time. Is there any objection to extending the special meeting through the rest of the business?
No, we have a motion on the table.
I'm sorry, that's right. We have a main motion. Thank you. Point of order. So to the main motion, is there any objection to the main motion as amended? Hearing none, roll call vote. Councilman Guard.
I got a call for the question.
Okay. Roll call vote, please.
Jeff Guard,
Yes.
Ann Schaefer,
Yes.
Melina Meyer,
Yes.
David Allison,
Yes.
Kathy Sherman,
Yes.
David Gleason,
Yes.
Tom Baylor.
Yes.
Motion carries 7-0.
Okay, so with the amended agenda to take item 7 before 6, the next item is a discussion of COVID-19 emergency response. This is an item council had asked for on the special meeting agendas.
This is Councilman Schaefer.
Councilman Schaefer.
I guess this is maybe more a question when we get our update from the IMT, but I was wondering how the progress is going on hiring the ambassadors for the harbor and for the airport.
They've been hired. We're in process. I think we have 2 on the ground, and we have more in the works that are going through the application process here, but there are folks on the ground.
And then, this is Councilman Schaefer again.
Go ahead, Councilman Schaefer.
Yeah, I was just wondering if there have been any more updates about antibody testing for the community.
Dr. Sanders, did you want to try to field that one, or I don't know that the community is actively pursuing them right now. But, go ahead, Dr. Sanders.
When you have a low disease burden in the community and you have a test that has, right now with such a low disease burden, a test that has anything less than, say, even 97% specificity, you'd have more false positives than actual positives. So at this time, it just doesn't, we don't have good data on any of the antibody tests. We don't have an antibody test we know is excellent. There's a couple on the market that look very promising, but so my advice is to wait on that, and we will have it and offer it as soon as there's one that has been either validated or when we have a higher disease burden and we really need to figure out the burden of our population.
Okay, great, thank you.
Thank you. And the backstory too is that the other test we're getting good quantity and good support from the state. Councilman Baylor.
Yeah, thank you. And Dr. Sanders, maybe you could comment on this, but previously we had a mandate that we were kind of requiring to wear your face mask in the gas station. But for myself, I think the bigger hazard at the gas station is the fact that everybody that comes in there grabs that gas hose and puts it in their car or their truck, and then they put it back. And currently there's no way to wash your hands. So it's kind of up to you to remember to bring your hand washing outside of your car, and then get your gas, put it in, and then before you get back in to wash your hands with your little hand sanitizer, to me, I think a safer option, I think would be beneficial, and and correct me if I'm wrong, if that's not a big contamination spot, would be to have a couple of hand washing sanitary little dispensers right out there. So when you went out there and pumped your gas, you could simply walk over and wash your hands, sanitize your hands, and then get back in your vehicle, rather than messing with your mask and everything like that. And the other part of that is where the gas pumps sit, that concrete is 5 foot across. So I've asked the manager of that if he could perhaps even paint a red line with the 5 foot, so that'll give you that indication like the stores are doing to keep that distance. And I've actually talked to him about the hand washing, but he has a hard time. He can't find a supplier for sanitation or the sanitizer, and I don't know if the city could help with that. But what are your thoughts on, the effectiveness of having that hand washing available right there at the pumps?
So I absolutely agree. I think that is an excellent idea. We can have hand washing or wipes to wipe down those surfaces, like exterior doors before you open them, or pumps, any high-frequency touch surfaces. If we can wipe those down, that's going to help prevent the spread of illness. Anytime that you could come within 6 feet of somebody, and really maybe even 10 feet, but between 6 to 10 feet, your risk of getting the other person's respiratory droplets is pretty low. At places like the gas station, where you might come in contact, or out on the harbor when you're walking the dock, you might come within that 6 foot boundary. That's kind of the only time we want people that are outside to need to wear a mask, is when you're going to be inside that person's 6 foot personal space. Really, maybe even 10 is ideal, because that is almost no transmission. But otherwise, outside is really a safer area. So I agree, what you're identifying, the gas handle is maybe more dangerous since you're outside, but I think we should do both.
Yeah, I agree. And so just maybe a comment for staff is I did talk with the operator, the manager of the shoreside, and he would be agreeable to putting those on, but he has not been able to find a supply for sanitizer. And I don't know if that's something the city of Cordova could help out with or not, but just give it some thought. Thank you.
Thank you. Councilman Allison.
Nothing right now.
Okay. Councilman Guard.
Yeah, this is either for the manager or the incident command team. Now that we've got our first confirmed case here in Cordova, I was wondering where we'd come. We talked earlier, the incident command structure talked earlier about contact tracing and setting up for that here in Cordova, and I just wanted to know where we were at with that in Cordova.
Do you want me to speak to that?
Please.
Contact tracing, in order to do contact tracing, ideally you have some training that goes into learning how to appropriately do those. The CDC has some courses, and there are some ways that we can get people trained up quickly. The state system is not overwhelmed. Their epidemiologists are experts at conducting contact tracing. They have the public health nurse here helping do that contact tracing, and so we're going to continue to support them and have them do the contact tracing. But we do have set up at the NVE's health center and the community health center with our nursing staff to step in if the state does end up overwhelmed.
And I would just add, Councilman Guard, that Dr. Zink did indicate that the state is proactively hiring additional contact tracing staff just in anticipation of a growing seasonal population.
I understand. I just remember early on in this, one of the reports we'd had from the incident command team, they were talking about contact tracing for Cordova, and I just didn't know where we'd take that.
That's in the hands of the professionals.
We're good about that.
Councilman Gleason.
Yeah, I don't really have any questions or anything, but I would say that you guys really did a great job at getting that announcement out to the public by 1 o'clock. I thought that was awesome. So good job for all involved with that. That's all I got.
Thank you, Councilman Gleason. Councilman Meyer.
Yeah, echo what Councilmember Gleason just said. Really great job getting all the information out there.
really appreciated the radio update too. That was very informative, and some of the articles that have been written already have been very informative. I kind of wanted to go off of something Baylor's kind of train of thought there. You know, getting the supplies for businesses, finding out where to get hand sanitizers, where to buy masks, gloves, anything else that business needs to conduct a really safe environment there. It's not normally the role of government to step in and help with those, but these are very challenging times to find appropriate suppliers. So anything that we can do to reach out to businesses or find suppliers to be able to fill that gap, or if somebody else in town wants to help fill that gap and get support from the city, I would be very supportive of doing something like that. I know it's not normally a role of government, but these are very challenging times, and it's challenging for businesses trying to find the right thermometers to get, or just the correct supplies. I can see how they can maybe be ordering something and it not coming actually how it's what they think they're ordering. So maybe if the manager can speak to that a little bit, or if something like that has been done or in the works.
We've been looking into solutions about how to get hand sanitizer in that can be available to the broader community, because it is really hard to find masks. It's really hard to find hand sanitizer. It's really hard to find a lot of the supplies that businesses need to feel comfortable opening. So we have reached out to some folks, and I know Incident Command Team recently was having a conversation with a brewery in Anchorage that is making hand sanitizer. It's only available to government entities. So we're looking into those things. I think the Incident Command Team is more knowledgeable about how far they've been able to get with that, but it is definitely a conversation.
And Council, also, unfortunately, because of the sequencing and everything, Kathy Renfeld with the Chamber of Commerce is going to be speaking on a guest speaker on behalf of the business community at the 7 o'clock meeting. I kind of toyed with pulling her in during your discussions and questions about the business posture, but you'll have access to her here in a few minutes. And if I know Kathy, she's listening along and taking notes. So, Councilman Sherman, part of that successful briefing that the other councilmen were mentioning today.
Truck by fire. I don't have any questions, but I do know that can echo what Helen's saying with the Incident Command Team, that we are looking at all the various options for additional sanitizer and masks in the community. So I think that's in the works, and I think some of that was even discussed with the state. That's all I have.
Okay, thank you. Any further discussion, Council, on the COVID-19 emergency response? Questions of the team or manager? Councilman Baylor.
Yeah, I could make this an audience comments, but I'll skip that one when I get to it. But the other thing I've been thinking about for quite a while is getting the community businesses to voluntarily require masks to enter. And I think that would go a long way of, to help convince everybody to have a mask, especially when they're uptown. And I don't know who did the drawing. I saw it on Cordova Prepared Facebook. It was a salmon, and it had a mask on it. I don't know if everybody saw that, but I thought that was really cool. And then I saw another comment down there that, we need to make the younger fishermen realize that this is important to save their industry. So you kind of put two and two together. I thought that mask was pretty cool, and having that around town, and it's wear the mask to save your fishery and yourself kind of a message. And maybe we could get creative with that and have some of those signs around, because really that's, for the fishermen, that should be the education that we're getting. And you're doing this for yourself to stay healthy, but you're also to save your industry, really. And I think the community businesses would support requiring. I've already spoke to a couple of them, and I think if we made the mask and put a little effort in, I think that would go a long way. But just a thought. Thank you.
Further questions or Councilman Sherman?
I was just going to follow up with that. You will see the fish coming out next week or so. and I believe all businesses will have them on their door, and that works as a collaboration between the incident management team, the city, and the Chamber of Commerce.
Thank you, Councilman Sherman. Other COVID-19 related emergency response questions, suggestions by council?
Mayor, this is Holly Wells. I have one comment just to clarify Councilmember Baylor's comment. In the state mandate, specifically in the retail businesses and for a few of the other industries, they are required to require patrons as well as employees. So in addition to your local rules, there is also very specific requirements applied to various businesses that do require those masks.
Okay, thank you for that clarification. So that is a requirement. That is a requirement.
At grocery store?
Yes.
Yes, all businesses.
Well, I just haven't seen it, so I was curious.
And I
Yeah,
Yes, of retail, there are some businesses, the retail businesses must do it. Non-essential business-facing businesses must require patrons. Others just require employees, but you still have your rules as well. So, they sort of all interplay together now.
okay. So did you hear that clarification, council? By the state mandate, the non-essential businesses are all required for the patrons and the proprietors to wear masks. For the essential businesses, the business staff have to wear masks, but not the patrons. Did I hear that right, Holly?
Pretty much, yeah. So a
Okay.
dine-in is different. They have parameters on tables, so they don't require patrons. Retail businesses are required, and so this is going to be a frustrating part for the community. Navigating the attachments that are specific to their businesses is not easy. They're very, very tailored to the industry that the state is addressing, but that's good. They're very specific, and so it will. I do think that having a easy reference to those attachments for the community, which you do with your website, directing them to the state attachments, is helpful.
Yeah. But the city mandate regarding masks is that all customers and business proprietors wear their mask indoors.
Correct.
Thank you. Okay. Any other discussion, council, on COVID-19 emergency response? And I think we can take up the timing of the next special meeting on our pending agenda on the regular council meeting, if that's okay.